Now, here are some things that I want you all to think about, and I want to just go down to the questions that are on this page. First of all, in order to make all of this stuff work, we've got to provide some pretty significant subsidies for people who can't afford coverage. So the question is, who can't afford coverage? Is it people at 200% of poverty, 300% of poverty, 400% of poverty? That's $88,000 a year. And if they're subsidized, if they're eligible for a subsidy, where can they get the subsidy? This, I think, is one of the most least discussed and most dangerous things in the legislation, is the fact that if a family can only get a subsidy through the exchange, which currently in any version of the bill, that's the only place they can get it, and at $88,000 a year in income, and if the value of the subsidy is more than the employer contribution by staying in their employer plan, what will happen? I think this is the most dangerous thing that we face. And so we're going to be looking at, working on very strong provisions what we're asking for is subsidies to be inside or outside the exchange. But in the event that they're just unwilling to do that, to just not let people peel out of the plan, and to give the employer the option to provide some additional subsidies if necessary. That's one of the most important things. The other thing that I think is a sleeper issue that I wanted to talk to you all about, because I'm running out of time, but I wanted to mention to you, this is something you may not have heard about. What you might have heard about is that there's going to be this excise tax, and this is the Finance Committee version, but this is likely to prevail, so this is why I'm talking to you about this. And that health plans above a certain dollar amount for individuals and a certain dollar amount for families, if your plan costs more than that, that you would be subject to paying that with after-tax dollars, the difference between the two, not the whole amount. Now, here's what the biggest problem is with that. It's what they count toward that number. So at first they were talking about using your health plan premium. That's easy to understand, right? And then they said, no, it's not just that. It's your health plan premium and your dental premium, if you have that. And if the employee has made an FSA election, it's that too. And if the employer is contributing money to an HSA account, it's that too. And, I'm not done. And if there's any supplementary health coverage, I'm not talking about disability, but like, gap coverage or anything like that, that too. Scary, huh? We're working on that one. But that could mean that a lot of us will be will be taxed on our benefits that haven't been before. And that's where a lot of the money to pay for some of this is coming from. It's kind of the fine print on some of these things. Not too much has been discussed about that. I wanted to mention it. I will say that, go to the one that says bending the cost curve. And by the way, there's a lot of information on these slides. I put a lot on there because I figure some of you will want them and we'll provide them to you. They're so that you don't have to take copious notes, is why it's on here. The Finance Committee bill does the best job of actually looking at some payment reforms that aren't just in the Medicare program, that actually extend into the private arena, that would facilitate things like bundling of payments and a little bit more efficiency in the way we pay providers. And those things are actually included in there, so hopefully some of that would prevail in the final product. The other thing I want to talk to you about is something that's not about the pending legislation. I want to make sure you're aware of something. When NAHU works on issues, we work in a couple of different areas. One of them is all these things I've been talking about, the federal legislative level. And then when the bills pass, we get into the regulatory process. And we work very heavily with the agencies on regulations before they come out. Well, during the last, when President Bush was in, there was a legislation that was passed on genetic discrimination, and it was sent over to the agencies, and then the administration changed, and different people started working on it. And the proposed regulations just came out. We are definitely going to be commenting on them, because when they defined what it meant for genetic discrimination to be prohibited in the underwriting process, guess what they included in underwriting? Health risk assessments. And so that means that in a health risk assessment, a lot of information that would normally be collected, like family medical history, couldn't be asked, which is pretty critical to determining a lot of things. In addition, there's a provision in there that says that the results of a health risk assessment can't be used to put somebody in a disease management program. Nuts. So you're going to be getting something from us about this. We're lobbying the agencies very hard on this. And I just want to let you know that that's coming up. We haven't really told you too much about it because it just occurred, but it's a multifaceted thing. So over the next couple of years, we do have very heavy involvement at the federal legislative level. But once a bill is passed, lobbying the agencies is just as hard as it is, and it's very labor intensive and it requires a lot of resources on our part. And then the third thing that you should be aware of is that if some of the provisions of the Finance Committee prevail, there are going to be a lot of things that are flipped to the states and to the National Association of Insurance Commissioners, where we have a very good relationship as well. And so it will just mean that your activity at the state level will be really critical, in addition to, because states will have, depending on what version of the bill passes, some degree of choice in how things occur. So in closing, the last thing I want to say is, last slide, that one? No, well, it doesn't matter. Some of the resource-heavy things that we're going to be working on are obviously at the federal level. We spend a lot of money on coalitions and that sort of thing.